Hi, it's Dr. Jerome Fryer of Dynamic Chiropractic Clinic. I wanted to share with you a little model that I've created that exemplifies often where the problems are in the cervical spine or in the neck. Many people come to me complaining of cervical pain, headaches, arm pain, shoulder pain, mid-back pain, and the common cause are these facet joints. Right here, these are the facet joints. So this is a C4, 5, 6, and 7 model. You can see that this disc here is similar to this color here, and this one's a little different. And why is that? Because this one has excessive motion at that particular segment. So you can see that when the spine is bent forward and the cervical spine is bent forward, there's extra movement at this particular level. Or when somebody rotates their head, there can be symptomatic sensitivity at the particular region. So if someone presents to me and they rotate and they go, oh, I can kind of feel that, or they present with pain, or they bend to the side. Often what's happening is there is a segment. You can see this one here. This one has osteophytes, which are the little spurs that project off the front of the spine. And this model here, this segment likely had been injured from a car accident or a particular sports injury, or I don't know precisely. I just know that the cadaveric specimens, the bones, have these osteophytes. This would usually indicate that this area over time has adapted and has become stiffer. Okay. Similarly, you can see here we've got some osteophytes at this particular level. This area also stiffer, but in the process of as time, it's a degenerative process, there is a certain stage where the joints become hypermobile or excessive mobility. And this is often where there's symptoms in the neck. So you can see how as the spine moves, that particular level moves more, right? Inflection, you can see how much more quickly these facets approximate, right? And extension. So these cases, the way I approach this is it wouldn't make any sense to create more motion or to stretch this, right? It's already overly stretched and it's moving too much. So often what I'll do is I'll evaluate the spinous process. So when someone is lying on their back, I'll push on the spinous processes to see, oh, okay, so look at that. That's moving a bit more. Okay, that's sensitive there. I work to increase the motion at the adjacent segments the best I can to create. So what I'll do is I'll decompress this level and this level to try to balance out the motion across the whole area that I suspect is being sensitive. That way, when somebody moves, not everything is coming from this particular segment, but you've got more motion coming from the adjacent segment. So this one, respectively, will move less because now these other guys are doing their part. So, yeah, sometimes it can be a bit tricky, with sleeping positions. If a pillow is up a little too high or a little too low, or someone's rotating when they're sleeping. So these cases are not simple often, and it involves sort of a complex look at all behaviors across the day and the night, looking at ergonomics, certain patterns. So there are some strategies to help sort of stabilize. Often, you want to think of this as you want to kind of splint this for a period of time and allow it to calm down, or allow these facet joints to calm down. You can see here I painted them red to show inflammation and irritation. So anyways, I hope that's helpful.